Hi there, this is Renee, and this is your clinical practice bite on the initial management of frostbite injury to the extremities in the emergency department. When I say extremities, I mean fingers and toes, ears and nose, and you have two main priorities when we're looking at frostbite injury. One is pain management, two is rapid rewarming when all risk of refreezing has passed. So for pain management, as step one, it's incredibly important to get that on board as soon as possible, because if you do not have adequate analgesia on board, your patient is not going to want to participate in the rewarming process. It is incredibly painful. NSAIDs are awesome as an adjunct, but if the frostbite looks severe, it may be contraindicated if the patient potentially could be getting alteplase, so something to consider. To initiate rapid rewarming of the extremities, you're first going to take a graduated cylinder and put 1,000 ml of hot tap water in there. We want that temperature to be 39 to 40 degrees, so you're going to use a bedside thermometer to guesstimate that. And if you get an error message or a plus sign like you see here, it's probably because the water's too hot, so you need to cool it down until you can get a reading. You're then going to add 30 ml of 2% chlorhexidine gluconate with 4% alcohol solution to that. And you're going to immerse the affected areas in this water. You want to make sure you remove any jewelry, and if there's things stuck to the skin such as socks or mittens, just leave it to allow the water to soften it so it removes a little bit more easily. You're going to continue to monitor this water temperature. You want it to remain between 39 and 40 degrees, so you may need to add additional hot water. It's also recommended to just put a towel over top to keep some of that heat in. After 30 minutes, or once that skin is soft and pliable, you can remove the extremities from the water and then just air or pat dry. And for next steps, I recommend going to clwk.ca for the full wound management for frostbite injury guidelines and resources.